Hey, Mobilization, how's it going? It's Todd Robbins. We're coming to you with CoFIT 20. We have our next class coming up with Devin. He is working on hip mobility and stability and working that into a flow. So it's gonna be a great class today. I want to thank everyone for coming today, and then everyone that's been with us in the past. We're doing 20 classes. So it's CoFIT 20 because we are trying to move past COVID-19. And things are starting to open up, in our local area. So that's exciting for us. And we just want to still get you guys information about what we're doing and what you can be doing at home during the time where you have some time on your hands and you want to stay safe at home. So thank you for coming. All the information that we give out here is for free. My name is Todd Robbins. I'm a physical therapist, and I own Robbins Rehabilitation East. And we have great therapists here who have put together a series of classes for everyone to do at home. So all we ask is that you just share it with your friends. If anyone needs this information or can use it at home right now, then I just ask you to share it with them. We're going to be, all these live on our Facebook page. So if you like us on Facebook, then you can watch the videos. And we're also building out a section on our website because we've had a response for that. So people want to kind of take a look at it. So we're really, really excited about that. It's hard to believe, but we're actually getting close to the 20th class. When we first started out, we said, hey, we're going to do 20 classes to teach our patients and friends about what they can be doing at home. So this is really exciting for us. So like I said, today, Devin's working on hip mobility and stability. Just a great physical therapist that works with us here, super smart, so you can learn a lot from him. I will give you our medical disclaimer. So I will say, guys, this is just kind of like education, okay? So, it's not medical advice. If while you're doing these activities today with Devin, you're having some pain or some problems or something doesn't feel quite right, I'm gonna ask you to listen to your body and stop that activity or try to modify it. Okay, and if you continue to have problems, I encourage you to seek a medical professional's advice. All right. Luckily for you, we are medical professionals, so you can come and see us. Actually, in our offices, we've continued to stay open in all three of our offices in Easton, Pennsylvania, Phillipsburg, New Jersey, and Lebanon, New Jersey. So, as part of the CoFIT team here, you can come to us for a free evaluation. Okay, if you want something checked out, you can come into the office and see us, and we're happy to check it out for you. There's no cost for that. So if you are having problems with any of these movements that Devin is going to take you through today, I really encourage you to call us 908-454-2404. You can find us on the Googles, I think. So, so I don't want to spend too much more time, but again, this is just education. So if you are having problems with this stuff, you really got to seek the advice of a medical professional, and I encourage you to give us a call. And also stay tuned. So we have more classes coming up. I'm excited about getting to the end of the series, and we'll have all 20 together, and then we'll get responses from you guys on how it went. If you have suggestions or things that you want to learn about, I really encourage you to put them in the comments. Also, as Devin's going through his class, comment and ask questions. He's going to get started here soon. So just make sure you're commenting and asking questions, then we can answer them, and you'll have more information. Okay, so I really encourage you to participate in there. All right, well, I don't want to take up too much more time. I do have to say, tomorrow is going to be my birthday, and I got an amazing card from my team here at the office. So I want to say thanks to anyone on my team that is out there and listening, and I'm going to enjoy my birthday tomorrow. But we are going to get to Devin right now, so stay tuned. Devin is going to give you a great class on hip mobility and stability, and just comment in there and we'll answer your questions. Thanks for coming out for CoFIT 20. We're having a great time doing it. I hope you're getting a lot of education and information about it. So thanks, guys.
Hey everyone, Devin here. Pre-recording our CoFIT 20 hip mobility and stability class. So if you've been following us on social media, we've been doing, here at Robbins, we've been doing a series of classes to provide some content to our clients and patients during this kind of unprecedented time of quarantine. And this is just our latest in a series of classes. So today we'll be focusing on hip mobility and stability. But before we get into that, or the meat and potatoes of the class. Just have to say that, as we always reiterate, that the information that we provide in this video is not medical advice. It's for educational purposes only. And in addition, if you have any pain with any of the movements that I demonstrate today, please consult a medical professional. Or if you're, just starting to decide whether or not you're going to engage in some activity, it's probably wise to consult a medical professional. And lucky for you, as physical therapists, we like to title ourselves movement specialists, and we are open here at Robbins, and we have a screening system in place to provide a free screen to clients. So that's something that you could take advantage of. So I'll introduce myself a little bit before we get into the content of the class. For those of you who don't know me, my name is Devin Cervani. I have a clinical doctorate in physical therapy and an undergraduate degree in biochemistry. And I've been with Robbins for some time now, and as I go through this class, you'll notice perhaps some continuity between, or at least redundancy with some previous classes. And just kind of bookmark that and keep that in mind, because we'll revisit that today. So let's get started. So we're talking about the hip joint. Okay, and the hip joint is a remarkable joint in the body. Of course, anyone who's a musculoskeletal practitioner, or anyone who has a passion for how the body moves and the joints of the body, could probably find something to say, something interesting to say about every joint, and honestly probably geek out about all the different things and the uniqueness of every joint and the role of every joint. But the hip really is a crucial joint, especially in the context of our society today. As many of you are probably aware, we are in the midst of an epidemic, not the epidemic of coronavirus, but the underlying epidemic of opioid abuse. So although there's been some rising awareness of that, as it's touched more families in the United States over the past couple of years, it's still present in the background. Part of the reason that there is this opioid epidemic is, or at least say a contributor to this, is the rising disability rates throughout the United States in regard to low back pain. So it's one of the most common conditions, common causes of missed work and lost revenue to businesses and costs to the medical system. And it's really important to think about, analyze what's going wrong. Where is our medical system failing when it comes to back pain? Well, I would say that one of the ways that our medical approach, or at least our conceptual approach to treating back pain, comes in the form of us focusing solely on the back and not on the joint that is very intimate to the back, almost inseparable, and that joint is the hip joint. So I just wanted to add that bit in, because some of that importance can easily kind of be lost in the background when we're focusing on other things, but it really is crucial, and I think it makes some sense. So let's talk about the hip. So the hip is a ball and socket joint. Okay, so you have your hip bones called, it's actually the innominate bone, but and it's a fusion of three different bones. Where those three bones come together, that forms the socket, and that socket is called the acetabulum. On the other hand, you have your femur, your thigh bone, which forms the ball of that socket. In order for us to be healthy, to move healthily, for the hip to be a healthy joint, and by extension for the spine to be healthy, some things have to happen when we move, and that allow the hip to maintain a certain degree of integrity. And what I mean by that is, as the ball of the hip rolls in the socket, that ball needs to remain centered. So there's a degree of centration, as we call it, that needs to happen as you're moving through a range of motion at the hip. Now that's really important because the way we live, especially in the United States as a society, is not really conducive to spending time in the ranges of motion, or what we'd call the end range of motion of a lot of our joints, but particularly the hip. And this, I would relate back to what I was talking about earlier with back pain. I think to some degree there can be a correlation with our activity levels and the way that we move with our back pain, but also with the hip. They go hand in hand. So we spend a lot of our time sitting, and that's, I'm sure many of viewers today will have heard that, and associate the effects of sitting on back pain. But just think for a second about the effects of sitting on your hip and your hip range of motion. When you're sitting, you're generally in an unsupported, or you're in a supported position, and you're in this kind of almost like a squat, but not truly a squat, because there's no degree of, you're not achieving the end range of motion that happens at the hip with the squat. And before there were chairs and before there were toilets, we had to squat down very frequently. And so I'll just demonstrate what I mean by a squat. This is what kind of a somewhat ideal version of the squat looks like. And you'll notice there's a lot of combination of movements from the foot, the knee, and up towards the hip. But this is what we would call end range hip motion. I'm really bent forward at the hip. So if we don't spend time in a position, generally, just think of the saying, if you don't use it, you lose it. So as we sit and spend more time habitually sitting, we lose access, as I would call it, to the deeper ranges of motion when we're considering the hip joint. So the loss of motion, or the loss of accessibility of different degrees of range of motion in the hip can be a tissue issue. Okay, so it can be an issue of length. So because we don't spend time in a certain position, the tissues around that joint physically shorten, or it can be more of a neurological issue. So that in plain English, the neurological side of things is the brain, because it becomes essentially unfamiliar with that range of motion through a complex system, basically limits you by making you feel tight and not allowing or making a position feel uncomfortable. And so to speak, denies you the accessibility to that range of motion. So where does that leave us then? Okay, so ideally, we should be spending more time in these different positions, in these end range positions. But just think to yourself, when was the last time you really spent a good amount of time at your end range of motion for the hip, like I demonstrated in some capacity? It's probably very infrequently, just because our environment doesn't call for that, and we are creatures of our environment. So what we're going to do today is go through some alternating hip mobility and stability movements. The idea being that if we obtain a change in range of motion, which we often do, if we obtain a change in range of motion for the better by doing some mobility work, that's usually temporary. And so we follow that up. We try to reinforce that pattern. And if you watched the previous class I did on neurodevelopmental training or treatment, this might sound a little familiar, but we try to reinforce that pattern with a similar movement. So I'll show you what that looks like in a second, and we'll get into that. So what it comes down to is we need to unlock the ranges of motion that we don't spend time in, by getting into or approximating those positions. And then we need to follow that up by habitually spending more time subsequently in that position. And that habitual nature helps us re-ingrain that pattern, both from a musculoskeletal perspective, so the muscles and structures physically get used to being that pattern, but the brain also gets used to it too. So we're going to go through a series of movements. If you have any pain with any of these movements, please don't push it. use your discretion and judgment. Listen to your body. This is often with the hip and back, it's often a case of listening to your body and modifying appropriately. So, and a final point before we get started is that the hip anatomically is an area of the body where structure really matters and really changes things. So what I mean by that is people have very different hip structure in regards to the angle of the bones and the twist of the bones of the femur, so the thigh bone, and then the shape of the socket and the shape or the orientation of different parts of the bone. So I'll discuss some of that as we start going. So we'll go through some things and we'll approach things. I'll try to throw in some more tidbits of knowledge and approach it case by case in terms of each movement. Okay. So the first thing we're going to be doing today is something called a hip hinge. Okay, so this is we're going to work our way into these deeper end ranges of hip movement. So a hip hinge, quite simply, is you imagine that there is a hinge point at your hips and you bend around that hinge point. Okay, so we'll just do a couple of these. And if you have some type of long, like a PVC pipe, or a cane, or an umbrella, this can kind of help cue you to accomplish what the hip hinge is. So really, most of the movement here is at my spine, it's at my hips. And we'll vary our stance, we'll widen our stance a little bit. And I'm not keeping my knees straight because of, personally, some mobility restriction. But straightening the knees is an option here. Okay, so notice my back isn't really bending, it's mostly my hips. Okay. So now what we'll do, I'm going to bring my feet together. And you don't need any accessory for this, but I'm just choosing to kind of hold this to guide me. We're just going to rotate side to side. So the spine is moving with this, but a lot of the rotation is actually happening at the hips. So I just widen my stance. Feel free to do that. Now we're going to combine the two motions. We're going to hip hinge. And then we're just going to rotate. Come back up. When you hip hinge, you should feel some engagement in the back of the thigh, hamstring. So hip hinge. Okay. So that got us started. Now we're going to go into a couple deeper movements, deeper in terms of achieving the end range. Okay, so if you have a pillow or a carpeted surface, encourage that. Hard surface is okay, but it might irritate the kneecap if you're kneeling on it. All you're going to do is you're going to get into a half kneel position. Again, think back to the NDT class that I did. A lot of these movements will be reminiscent of that. And we're just going to go into hip flexion. Okay, so that's when you lean forward and bend the knee up towards you. So I'll show you from the side on my right leg. And I'm just arcing forward, trying to keep my torso upright. And I get to the position, what I'll call the position of restriction. I didn't come up with that term. When I get to this position of restriction, I'm going to take a deep breath, then exhale, really feel in this area a lot of engagement, a lot of tightness. So now what we'll do in the same position, I'm arcing, I'll show you from the front, I'm arcing my knee out to the side, to the inside, and what this is doing is it's changing the orientation of my hip. I'm just moving my whole body kind of into different positions. I would liken this to an exploration. Just explore these positions. What do they feel like? If you're only getting to here, you know, if you're pretty upright, you're not able to get as far down. Some people may be able to get all the way down to their elbows. I have a little bit more trouble with that. I can't even get close. But just explore that position. Okay? Do the other side as well. And note any differences for yourself side to side. I'll show you from this direction. The further you walk your leg away from your body, the harder it's going to be. So try to walk the line of getting a engagement stretch feeling while not causing discomfort. So you'll notice here, what you can also do is kind of just rotate, okay? Rather than, I call this arcing the knee forward. You can also just rotate. And all this rotation is happening at the hip. All right, so pause a second, see how we feel. And we're going to progress that mobility into a stability exercise. So you're going to come forward, same position as before. Opposite hand, so left leg forward, right hand down, and you're going to rotate, reach and rotate with your opposite hand. And just breathe at your end point. I'm just going as far as I can comfortably. I'm keeping my foot, keep your foot on the ground. I really feel that in my hip. Breathe. Now you're going to come down and reach underneath. If you need to, back it up. Come up and down. Switch. Opposite hand, opposite leg. Rotate, and when you rotate with your trunk and your upper extremity, you're going to follow your hand with your neck and eyes. Breathe at the end point. You might find that after a couple breaths, you're able to increase range of motion a little bit. All right, so now kneeling on the same surface, we're going to work into the opposite motion. We just did a lot of hip flexion. Now we're going to do some hip extension. So I'll show you from the side. I want you to rock onto your heels if you're able to. And then from your heels, you're just going to extend your hips up. Back shouldn't really move or be involved. Should be mostly hips. Just going to sink back. And then back up to extension. But the key with this is just moving slowly, slowly, slowly. get up off the ground now. And we're gonna take that same lunging pattern we just did, okay, with the hip flexion, and we're gonna make it into, we're gonna progress the stability of it. So at this point, you should probably feel a little bit looser, at least felt like you did something. And the idea is we probably have some more range of motion, even if it's temporary. In a patient-client setting, we could do a test-retest. So test you before, test subsequently to the intervention, and then see if we had an effect. But regardless, if we've had an effect on range of motion or mobility through the things that we've done so far, we want to reinforce that. So now we're going to do a lunge pattern. Okay, so we'll call this a star lunge. All we're going to do is you're going to lunge forward. The depth of the lunge doesn't really matter, or I should say it should be proportional to how far into a lunge you were getting. All right, so if you were going as far as I was, you should be able to at least get into this position. And then you're going to step back. We'll alternate legs. So notice I'm just kind of tapping the ground, not fully unweighting. My hips are staying level. Now we're going to go at an angle. Go the other way at an angle. Kind of move clockwise in the sense that we're aligned with where the hands of the clock would be. Just got a pop in my hip. You can play with the depth with the lunges too. Now we're going to lunge behind us. To me, this is like a 4 o'clock, 5 o'clock lunge. And mirror that. And straight back. Do that one again. Good. Some people ask, what do I do with my hands with this? Whatever's comfortable. I leave them at my side, or I cross, or I put them behind my back. Just try not to use them. Okay. Pause 1 second. Let me look at what else I had planned. We're going to go back to a mobilization. And this mobilization, you may not be able to do at home. You need a secure surface to attach a band to, and the band has to be a pretty high intensity. What I can do, I just want to demonstrate it because it illustrates what I was talking about centering the ball of the joint in the socket. We can link the information to either getting one of these bands or creating a similar type of tension situation on your own, a do-it-yourself type deal. So what you need, and what I'll demonstrate, is a high tension band. And we're going to be, and I'll just spend a minute or two on this just to illustrate the concept. You're going to be in that half kneeling position that we were last time, referring to how we started. And you're going to work yourself into a position where the band is pulling away from your hip. So if it was this side, it would be pulling kind of to the side and slightly back and down. So that means I have to be in this position here. And then I go through that same movement that I did before, where I lean forward. And what's happening is, yes, I'm stretching the muscle units around the joint, but what's also happening is the force from this high tension band, and it has to be high tension because of how much tissue is around the hip on most individuals. What's happening is that tension is pulling the ball of the socket, or the ball of the joint, centering it in the socket. And I'll show you from a different angle with this hip what I mean by that. So you get this band right up into the groin area. It's as close to the joint as you can get it. This was what we would call a self-mobilization. Then I orient, the band is pulling away and back. And I lean forward. You need to actually so that's something that is very useful for centration of the hip. And in terms of a do-it-yourself, which I can provide a link to a video that explains that, using the inner tubes of bike tires can work. And the video, the do-it-yourself way, credit to that goes to Kelly Surratt and the Ready State. A lot of the inspiration of this video does come from that as well. So I just wanted to demonstrate that. So now we're going to go back to something a little bit more simple. And we're going to take advantage of all the mobility work we just did. And we're going to do some squatting. So I have here, we're going to attempt some squatting, I should say. We have here is a half roll. This is only to be used if when you squat down, your heels, you're not able to keep your heels on the ground, okay? So if that's the case, you'll prop your heels on the half roll, or in the case of equipment to be used at home, anything that really just elevates your heels about an inch or two. And then you should be able to squat down. And what we're gonna do is just spend time in this position, okay? Remember, if we don't use a position, we lose that position. So in this position here, we'll do that same arcing motion, okay? Now the ability to do this depends on the health of your knees as well. So that's something to keep in mind. If you need a surface that you can hold on to while you're doing this, so what we're trying to do is get the hip in a certain position, get the ankle in a certain position, and just explore what it's like in that position. So I'm going to step off, get into a deep squat. And where do I feel this right now? I mean, I like to consider myself as being able to squat decently well, but this does not feel comfortable to me. And for many human beings on the planet, this is a comfortable position. This is something that's used. So right now I feel a lot of burning in my shins. That's my front of my shins, the muscles pulling them forward to keep me from rocking back. So change my angle. Those muscles have to be active to keep me from shifting back. So once I'm in this position, I'm at my end range hip flexion. So my hips are bent up pretty much as far as they go. You might not be able to get here. You might feel like you're here. You might get to this position and things tighten up. Work with what you have. Use support. Use a chair, use a table, a counter to get yourself down as far as you can. Ideally, you stay upright. Torso stays upright. And then once you're here, I rest my elbows on my knees and I just rock back and forth. You can spread, use your elbows like a butterfly and push in. Helps you get some rotation. Try to stay upright. Do as I say, not as I do. I'm looking straight down, try to stay upright. That was probably about 2-3 minutes if I had to guess. And I can just feel it. I can really feel that. So that's something to just make note of. and consider, because that is a fundamental movement pattern. Again, think back to the class I did on NDT. Babies do this all the time. There's no struggle. In fact, they'll even get up from that position. So what we'll do now, all you need for this, if you have a belt of some kind, that would work, but you don't need one. So I'll show you what we're going to be doing. Belt goes around the foot. We're going to do what I call an active straight leg raise. Okay, so I'll show you with the belt, and then if you don't have one, I'll show you how to do it without the belt. So what I'm going to do is I'm going to passively, so with the belt, I'm pulling my leg as far as I can, okay? So right about here, I start to feel a lot of tension. Once I get to that point, we'll call it the first barrier. Once you get there, you're going to you're going to engage your legs and try to lift up on your own accord without the belt helping. And then relax. So you'll find, I stop here because that's starting to get uncomfortable. And then I engage and I'm able to get a little bit more. And you don't want your hips really rising that much in terms of the back of your hips coming up off the floor as you do this. But a little bit is okay. Now, if you don't have a belt, all you have to do will actually modify it and go into the next one. You'll pull your